With that, I will turn it back over to our very expertise last panel here, Councilmember Middleton.
Yay. First, can we get a round of applause for Hillary, who has just moderated 3 panels? That is pretty impressive. So we're down to close to the end, and we've got, I think, a really good panel to finish with. I'll pick up on a theme that we were just talking about. In terms of housing, one of the critical places, and it was identified, there is a need for more affordable housing, and some of that is being built. We are building right now the first affordable housing unit that has been built in Palm Springs in over a decade. That's going in at the corner of San Rafael and Indian Canyon. There are going to be, I believe it's 64 units that will be available on an affordable housing basis. We acquired land recently as a result of the settlement with GRIT, and we have already identified that that we want to use a significant amount of that land for affordable housing projects, and we're beginning conversations with agencies that do affordable housing to partner with us. There's nothing that I can take and announce at this point, but it is a priority for this City Council to see to it that we make it easier for individuals who want to build affordable housing. There are lots of folks who are interested in coming into Palm Springs and building very high-end homes. And we're pleased to see that people want to build within our community, and those homes are being built as well. The struggle comes in the middle. And right now, finding market forces and entrepreneurs that want to come in and build in that middle is difficult throughout California. And the governor has identified that new housing is something that's incredibly important. We should, in California, be building approximately 180,000 housing units just to keep even. We're building about half that in the state. And so long as we're not able to build enough housing to keep up with the growth that's occurring, then we do fall farther behind. Part of that is going to require that we need to make it easier for developers to build homes, particularly developers that will build homes in that medium market. So we're looking at how can we reduce our fees? How can we make it easier for them to move through the approval process? In Sacramento, the legislature is certainly looking very clearly at how do we make it easier for people to build in California. Some of that needs to come back to all of us in the community to recognize building new homes is something that is important for all of us. And if our attitude and approach to the person who wants to build in your community is, why don't you go somewhere else? We will have some folks who will go somewhere else. So it's a struggle to make sure that we build in a way that is sustainable, that we build in a way that respects the environment and our community, but we need to be building more homes. People are going to continue to come to our state and to other places, most particularly because of all of the things that we've talked about today. Given a choice between living in a community that you know will be affirming, one that you know that will understand who you are and gives you an opportunity to create community, you're going to want to go there. I look forward to the day that those communities are in Ames, Iowa, that they're in Duluth, that they are in every community across the country. But today, in the 21st century, those communities are largely in places on the coasts and places where the cost of living, unfortunately, is among some of the highest. And as I said in my op-ed this week, some of the most difficult, heartbreaking conversations I have been with individuals who have been out for 30, 40 years. They are living on a very fixed income here in Palm Springs, renting usually, and frightened to death that they're going to have to move back to the community that they grew up in, a community that still feels like a stranger to them. So with that, as an intro, let me remind everyone that we have some really great people that have been here all day today that will be around afterwards to provide more information. And most of the panelists are going to be here until about 1 o'clock. I would like to also give a big thanks to every one of the panelists. We did not pay a dime for anyone to come and make a presentation today. They did all of this on their own cost and their own expense because they believe in this community and believe in what we're doing. And I want to do a big shout out to a couple of people who are here that have some wonderful organizations that were not a part of the panels today, but we will not miss you in the future. Jack Newby from the Jocelyn Center in Palm Desert, and Beverly Greer from the Neurovitality Center here in Palm Springs. So with that, I'm going to ask Michael Adams to come up and to talk about the state of the law nationally, the federal laws, and some of the actions that are taking place in other states, and touch on California. And then at the end, I'm going to come back and talk to you about Senator Scott Wiener's LGBTQ Senior Bill of Rights that was passed and signed into law in 2017.
Okay, and I want to apologize that I will not be able to stay for the last hour. I have a flight at 1:30, so I'm going to be heading out shortly after speaking. And because I'm not going to be here, there were a couple of questions that folks asked that I otherwise would have talked about in that time at the end, but let me just very quickly respond to these two questions before shifting into the policy discussion. One was a question asking us to explain more about SAGE and specifically their services or benefits that we can avail ourselves of individually. So just to answer that briefly, I'm implied that both Hillary and Kimberly Jones from SAGE are here and happy to talk more about this in the last hour. So SAGE is not a local service provider, so it's different from Center of the Desert and Desert AIDS Project in that we don't have local on-the-ground services. What we do focus in communities across the country, including here, are community education programs like this. And some of them are so-called self-starting programs like Sage Table that was referenced earlier by Candace, which is a program where younger and older folks can come together and break bread. And you can find out about how to start one of those yourself on our website at sageusa.org. We have a community education series called Aging Well, which is a series where we come together and talk more specifically and personally about how we can age well as individuals, and we'll be bringing the Aging Well program to Palm Springs in the late spring. So if you're interested in learning more about that, please talk with Hillary or Kimberly. Second question I wanted to respond respond to is, does SAGE work at all with AARP, and if so, how? The answer to that question is absolutely yes. We've had an ongoing working relationship with AARP for more than a decade that consists of several things. It focuses primarily on community education, so last year, SAGE and AARP co-published a guide called Prepare to Care, which is a guide for caregivers in our community. We also have built a close partnership with the AARP Foundation, so they are supporting our own data collection work so we can learn from the housing developments that we are opening. And I'm really pleased to say that AARP Foundation has recently made the decision to endorse the SAGE HRC Long-Term Care Equality Index. And having that stamp of approval by AARP is going to be an important step. I would say, I think, in terms of public policy, AARP National has been, frankly, a little slow to come to the table in stepping out explicitly in supporting LGBT rights legislation. But fortunately, and SAGE has been working with AARP for years, fortunately that started to change in June when AARP publicly endorsed the Equality Act. And I'll talk a little more about the Equality Act. That was a big step forward, and that will make a big difference. So that's AARP. So let me switch into some policy conversation, and as a council member indicated, I'll start with a focus on the federal level and then talk a bit about California. And the context for the federal discussion is the reality for all of the reasons that have been discussed today. Many older folks in our community have, in fact, a greater need for elder services and elder care than older Americans in general, because we don't have the same kind of support systems and networks that other folks may have with adult children, etc. So, but while we have that greater need, the data indicates that we, elders in our community, are in fact 5 times less likely to access the services we need. And the reasons for that are the very things that have been discussed today. Fear of discrimination, fear of being mistreated, concern about, can I safely be out to these folks, right? So this is the conundrum that we need to work on and change. And the reason why that fact is relevant to federal policy is because the federal government is the big player in local elder services around the country. Every year, the federal government distributes $2 billion that end up in local aging offices and state aging offices that are then redistributed to our nonprofit service providers to provide those services. And so getting those federal dollars and the legislation behind them to focus on our community is critical, because the need is great and the barriers are high. And the situation that we're starting with is not a great one in that regard. Those $2 billion are structured and funneled, and the expenditure of them is determined by something called the Older Americans Act. The Older Americans Act, while it does have provisions for certain kinds of older populations who face special challenges, nowhere acknowledges the special challenges that LGBT older folks face. In fact, it doesn't even acknowledge that we exist. And this has been the fundamental and essential focus of SAGE's federal policy work for the last decade, to seek to change that and to amend the Older Americans Act so that it explicitly addresses the needs of our community and prioritizes us for those services. The Older Americans Act needs to be reauthorized. It's reauthorized generally every 5 years, and that reauthorization process, which is going on now in the latter part of 2019 and will continue in 2020, is the opportunity to seek to amend the Older Americans Act. Now, I think it's no secret to any of us the political context in which we live. The gentleman who sits in the White House, the folks who control the US Senate. It is a mean feat to accomplish that in this moment. Having said that, and I won't go into the specifics here, we are making some surprising progress in that regard. And later in the spring, we will have more to report, but there is the potential to make some progress on LGBT inclusion over the next few months in the Older Americans Act. So stay tuned and we'll talk more about that. And we'll come back to you perhaps at the Aging Well program in the spring and let you know where that stands. The other context that we're operating in at the federal level, of course, is the fact that we have no federal law that explicitly provides protection from discrimination for LGBT folks. This is something I hope we all know that we have been working toward and struggling for many years, and we have not accomplished that yet. What we do have is during the Obama years, there was some piecemeal progress that was made through federal agencies and regulations, etc., which was helpful. The challenge, of course, is that during the Trump administration, the Trump folks are seeking to roll all of those protections back. And they're making some progress. Just to give you two examples, in 2017, when they first came into office, the Trump administration tried to remove LGBT older adults from something called the National Survey of Older Americans Act participants. That's the survey that figures out who's getting federally funded elder services and who's not, so those services can be retargeted. We worked our butts off to get our community into that survey during the Obama years. The Trump folks tried to take us out in 2017. I'm really proud to say that we fought like hell, and we reversed that, and we are still in that survey as of today, which is a great thing. But as I think we know, their attacks on our community and others are relentless. And so one of the things we're dealing with right now are a series of efforts by the Trump administration to carve out exemptions from whatever discrimination protections we have, to carve out those exemptions for religious organizations and religious providers, which is a major problem for our community because, for example, we've heard reference, and Lauren talked earlier about continuing care retirement communities. 85% of CCRCs in this country are run by faith-based organizations, like Friendship Village. Now, some of them are fine and welcoming to our community, but some of them are not. And the notion that religious providers who are receiving federal funding would be licensed to discriminate against our community is just outrageous, and it's a big danger, right? And so that is something that we have to continue to be vigilant about and fight about. Similarly, we have made some progress in the courts, right? Over the last decade, our community, our organizations like Lambda Legal and National Center for Lesbian Rights have gotten a number of federal courts to rule that our community members are protected from housing discrimination, for example, under the Fair Housing Act. Some of you may know of a case brought on behalf of Marsha Wetzel. Marsha Wetzel was an elder lesbian who was living in an elder care community in Niles, Illinois. And she was treated horribly by other residents, subjected to terrible harassment, and the staff did nothing to protect her from this. Lambda Legal took her case and sued and challenged that as a violation of the Fair Housing Act. The lower court ruled against us and said that LGBT people aren't protected by the Fair Housing Act. But when the case went up on appeal, she won and we won. And the court ruled that we are, in fact, entitled to protections under the Fair Housing Act. That was important progress, but the Trump administration and conservative folks are really pushing back on that notion that we are protected under the Fair Housing Act and under federal laws that prohibit employment discrimination. There are 3 cases at the Supreme Court right now in the context of employment where the court will decide whether gender discrimination protections, which have been interpreted to protect us, do. Those cases were argued in October. We'll have a decision by June. We have a conservative Supreme Court, right? It's risky business what is going to happen there. If we lose those cases, then in all likelihood, the progress we have made, for example, in Marsha Wetzel's case, will eventually be reversed. And those principles that apply in housing will get reversed. So we've made progress, and we are at risk for sliding backwards because of who we have in the White House and because our federal courts are becoming increasingly conservative because because of who we have in the White House, right? So not to put too fine a point on the matter. Having said that, there is opportunity for progress, and we are making some progress at the federal level. As I referenced earlier, we have, I would say, a healthy fighting chance to make progress this year in some new helpful provisions in the Older Americans Act. That would be, as I referenced earlier, tremendously important progress. And we have the Equality Act, which all of our organizations, HRC, SAGE, and many others, have been advocating for. That is a federal piece of federal legislation that would prohibit employment, housing, and public accommodations discrimination for against LGBT folks. That the Equality Act passed the U.S. House of Representatives. I think we can predict that it is not going to pass the U.S. Senate, given who controls the Senate right now. This is why elections matter. We have the House. If we have a friendlier Senate and a friendlier White House, we will enact the Equality Act. And finally, we will have anti-discrimination protections all across this country. And so that is something that we can and need to work toward. And I'm pleased to say that SAGE worked closely with the authors of the Equality Act to insert language that is specific to LGBT older people into the Equality Act. So if it is enacted, there will be absolutely no question that it prohibits discrimination in nursing homes and assisted living, in senior centers, in any place that we receive services as older people. So that's an important one, not just to watch, but to work for. Every time you are asked to do something to support the Equality Act, please do it, because it's really important. Let me switch to California. Folks who live in California, I'm a former California resident, are blessed to live in the state as LGBT people and LGBT older folks, because this state is in the lead when it comes to providing legal and public policy protections for LGBT older people. Equality California has been a great leader on that, and it was great to have Robbie here earlier. SAGE has partnered closely with Equality California in that regard. A couple of these things have been referenced, but I just want to say briefly, there are 4 laws that have been enacted in the last several years that are very important. A couple of them have been referenced here already. The LGBT Long-Term Care Bill of Rights, right? And the council member is going to talk about a little more about that in a bit. Very, very important that we be protected in long-term care. A piece of legislation that requires aging service providers to collect data to actually figure out to what degree they're serving us and not serving us, enacted here in California. A mandate for LGBT cultural competency training of providers, enacted here in California. And importantly, a piece of legislation that establishes that older folks in our community are a priority population for state-funded aging programs, enacted here in California. This is tremendous, tremendous progress. The trick is that these laws are only valuable to our day-to-day lives to the extent that they are implemented and enforced. And that is not automatic. That requires hard work. Some of you may have noticed there were a bunch of media stories last fall after the training mandate was enacted, where that law says that aging service providers have to provide training and collect data. So a bunch of stories appeared, and I'm sure this was not by accident. These are stories that were organized by folks who were not our friends, telling sad stories of little old ladies in Meals on Wheels programs who, shock of all shocks, were being asked what their sexual orientation and gender identity is, right? So when you read that kind of sensational story in the media, it makes it sound like a terrible idea, right? But the reality is, for decades, we have been asking people in service programs all kinds of questions that are important to know so that we can craft those programs. We've been asking people their age. We've been asking people their race. We've been asking people their ethnicity. We've been asking people about their health conditions. LGBT status is just one more thing, but we have some obstacles to overcome, right? So that's about implementation. I want to say we have some great friends friends in that regard, the California Commission on Aging, which last year held a public hearing on LGBT aging issues right here in Palm Springs, has been a great partner in that regard, and will continue to do so. We had the Commission had a conference on aging issues earlier this month that was hosted by the LA LGBT Center. LGBT issues were front and center, and they will continue to push for us. Similarly, the California Department for Aging has been an ally, and after the training mandate was enacted, SAGE provided training to the staff of the California Department for Aging and how to effectively implement this law. Also, I want to put out a plug. We have the governor's master plan on aging is in the works right now. There are public hearings happening across the state. It is critically important that we as a community be actively involved in those hearings, that when those hearings happen, folks from our community need to be there and standing up and speaking out and saying, you know, that these laws need to be implemented. Ed Walsh is here somewhere. Ed's in the back there. He's got his hand up. I'd say, please talk with Ed to learn more about what's going on around the governor's master plan so that we make sure that we're present there. I'll just say a couple more things in closing, which is we are lucky. Those of us here in California are very lucky to be in the state, and this is not the norm, unfortunately. As a council member indicated earlier, there are many parts of this country where these kinds of advances have not been made. There are 26 states in this country that provide, at the state level, not one shred of legal protection against discrimination for LGBT people. 26 states, that's the majority of the states in this country. We have a lot more to do. And having said that, because I always want to end on a positive note, is that, and we are making progress. And SAGE has been working not only with Equality California, but with LGBT equality groups all across the country. Just last summer, the Illinois legislature enacted legislation that makes not only LGBT older adults, but older adults living with HIV a priority population for state aging programs. The governor signed that legislation. That's a big step forward. We've made big progress in Massachusetts. We have a landmark bill that has been introduced in Rhode Island. We've got some really exciting stuff going on in Pennsylvania. So this is the work as a movement, as a community across the country that we have to do, is we do need to create a world where it is safe and welcoming to be LGBT and older, no matter where you live. AARP did a study last year that found that 29% of LGBT older people live in rural areas, 29%, and that only 1 in 10 of those 29% of rural LGBT elders reports having access to any services or care that could be seen as even mildly LGBT friendly, right? So that's the work in front of us. I mean, that's the work that as a whole, as a community that extends across the country, we can do, and we're doing it, and we're making progress, and we will continue to do it together. So thank you.
Okay, we are about to the end. I've got a couple of questions that I'm going to try to quickly answer. One is, please explain how and if Riverside County has improved on the Ellis Act protections for evictions. And I did have a chance to speak with the folks at the County Office of Aging, and they are trying to step up on that, but it remains a significant issue that we have too many evictions there, and I think that the other person and place that we can go is to County Aging Office, as well as Supervisor Manny Perez's office, to provide help for the county to get more effectively involved. We also had a question regarding LGBT individuals who are incarcerated, and that is very clearly a significant issue. I am not expert in that area. Equality California did carry a bill this year. It did not pass through the legislature that would have provided protection to transgender individuals who were incarcerated, to ensure that they had a right to be housed within a facility that was gender appropriate for them. And that bill did not pass and continues to face steep opposition. And again, my congratulations to Equality California for the willingness to take on tough bills, and this was one of those. I'm going to close, though, with something that's good, and that is a bill that was passed in 2017, and that was the SB 219, sponsored by Senator Scott Wiener out of San Francisco, and Senator Wiener has taken on numerous issues for our community and numerous really tough issues. This bill has been referred to as the Senior Bill of Rights. It's really specific to issues around individuals who are in residential care facilities or skilled nursing care facilities. A residential care facility is a place that you go to live. Generally, they are always multifamily buildings. Frequently, you have a studio or a one-bedroom apartment, and there may be some communal meals that are served within those residential facilities. They provide help to you in performing the daily events of life. Washing clothes, eating, doing all of the things that anyone would take and do, but they do not provide health care. They do not have nurses on staff to work with individuals. So those are residential care facilities. Nursing care facilities are providing clinical assistance to their patients. This bill covers both of those, and it provides protections based on sexual orientation, HIV status, gender identity, and gender expression. The bill made it illegal to deny admission. It made it illegal to transfer or refuse to transfer a patient or an individual based on any of those four statuses, to discharge an individual, to deny people the right to choose who their roommates are going to be. And where rooms are being assigned by gender, that an individual will be assigned to a room that is based on gender, based on their gender identity, based on their gender expression as they define it. It prohibits residents from harassing, from demeaning individuals based on sexual orientation, HIV status, gender identity, and gender expression. And that happens. Restrict a resident's right to associate with residents or with visitors, including the right to consensual sexual relations with the person of their choosing. The section made it precluded a facility from banning or restricting sexual relations based on who you are having sex with. It does allow a facility to say, we do not allow any sexual relationships to occur within our facility. I'm not sure how they're going to enforce that. And lastly, it made it illegal to deny or restrict medical or semi-medical care that is appropriate to a resident's organs or bodily needs, or provide medical or non-medical care in a manner that similarly situated individuals would receive. So as we all know, and as Mr. Adams said, passing laws are one thing. They still have to be enforced. So I want to give you 3 3 organizations that you need to be aware of. If someone is in a residential care facility and there is a concern regarding the treatment they are receiving there, it is the California Department of Social Services that is responsible for enforcement. If they are in a skilled nursing facility or healthcare facility, it is the California Department of Public Health that is responsible. And it is, by the way, the California Department of Public Health that has the authority under certain circumstances to remove a license. Lastly, if the issue is one of discrimination, it is the Department of Fair Employment and Housing that has responsibility for investigation and enforcement. If you don't know who to call, and you think there's a problem, you may call me and my office. I will not be able to fix everything, but if the question is, I don't know who to call me and I will try to find out who it is that you need to call. A couple of last thank yous. We did an awful lot of work in scheduling to have Congressman Raul Ruiz here today. He was otherwise detained. But this event, in large part, is a product of a conversation that I had with the congressman about a year ago, along with Dr. Les Sendel, who is on our Desert Healthcare Board. And we got on to this topic of LGBTQ and aging. He immediately picked up on the issues of social isolation, culturally competent healthcare, and the need for affirming communities. So we're hope that this is the first but not the last event of this nature that will take place. And we very much hope that this is not the last time, we very much hope this is the last time we have to deal with an impeachment issue. I'm going to say one last thing on SB 219, and I'm not going to be political. I'm simply going to record for those legislators who are in Riverside County and serve Riverside County. In the state Senate, Senator Connie Leyva and Senator Richard Roth voted yes. Senator Jeff Stone voted no on that bill. In the California State Assembly, voting yes was Assembly members Sabrina Cervantes, Jose Medina, Eduardo Garcia, and Chad Mays. Voting no was Assembly member Melissa Melendez. You may want to remember all of that. We are going to have an opportunity for folks to stick around to ask more questions. I began today by saying this was about dignity. We will end. This is about each and every one of us having dignity until that very last day that we have. Thank you all for being here.